My name is Anthony Asagi, COO and co-founder of Journey Health. We are a group and individual health benefits ally that is insurance company agnostic, so we can provide unbiased benefit options. Our mission is for every employee and family member to get the quality care and coverage needed without overspending. If you run a small to mid-sized business, say 20, 75, maybe even 150 employees, you already know healthcare is one of your biggest headaches. Every year you brace yourself for the renewal, hoping the increase isn't too brutal. Meanwhile, your team is stressed about deductibles, co-pays, and whether they can afford to use the plan you work so hard to provide. It is so expensive, complex, and confusing for everyone involved. In the first part of this series, let's break down why this keeps happening and what it means for your business. For all businesses, healthcare costs climb faster and sting harder for small companies. On average, small group health plans rise 10% each year, but some owners see 20, 30, 40% increases with no explanation. Unlike large corporations, you don't have an entire benefits department negotiating better terms. You're often stuck with a handful of carriers, high deductibles, and little leverage to push back. Think of it like buying wholesale versus retail. Fortune 500 companies get wholesale rates because they bring thousands of employees to the tables. Small and mid-sized businesses, you're paying retail prices for the same care, and retail keeps going up. So the price tag, what are we talking about in real dollars? According to the Kaiser Family Foundation, the average cost of family coverage is now over $24,000 per year. For a company with 40 employees, just covering half of them on family plans could mean spending close to $500,000 a year on premiums alone. Most employers cover around 50% of premiums, which puts you on the hook for about $12,000 per family. Employees pay the rest, often $12,000 out of their paycheck, plus higher deductibles when they actually use the plan. For many workers, that deductible is now $5,000 or more, money they just don't have lying around. So even when you're doing the right thing as an employer, your employees may still feel like healthcare is just way out of reach. And on top of that, outcomes aren't improving. Here's a kicker. All this money isn't buying better health. Chronic conditions like diabetes and high blood pressure are more common than ever. Access to primary care has gotten harder, not easier, and mental health challenges are spiking. For a small business, this hits close to home. If one key employee is out for weeks dealing with a health issue, you feel it immediately in your operations. So rising costs and declining health outcomes are a 1-2 punch that hurts both your people and your bottom line. So why should you care so deeply? This isn't just about doing the right thing for your employees, it's a survival issue for your business. Health benefits are often the second largest line item after payroll. If your premiums go up 10% or 20% or 30%, where do you cut? Is that raises? Is that equipment? Is that marketing? And when your competitors down the street offer better coverage or lower paycheck deductions, your recruiting and retention takes a huge hit. I've seen so many small employers lose top talent not because of salary, but because of benefits. Employees are weighing total compensation, and healthcare is a huge part of that equation. So here's where we stand. Healthcare is expensive, and it's rising faster than your revenue. And it's not delivering better results for your employees. Small businesses are paying retail rates for wholesale outcomes, and it's crushing budgets and morale. But there's good news. There are ways to take back control, and it starts with understanding how benefits are sold to you in the first place. Whether through a broker, a PEO, or even a payroll provider, the procurement path you choose shapes your costs and your options. I recommend finding an unbiased advisor that can help you navigate these options.